Hello. Hi. Hi, everyone. I'm Dr. Edwin Guerrero. Many of my patients call me Dr. G. Let's wait a little bit more to start to discuss and explain about one type of bariatric surgery, SADI-S surgery. Okay, so I want to explain about this surgery because not many people have heard about this, such as with other bariatric surgery, such as gastric sleeve, gastric bypass, or mini bypass. SADI-S is not very common to hear about this surgery, but it is a very important procedure that could be very useful uh, for many patients. And as I always explain to all my patients, it's not like there is one surgery that is the best for all patients. No, we must evaluate each patient, and depending of the patient, we should give the best option, the best bariatric surgery for each patient. So we have talked in prior live sessions about gastric sleeve, about gastric bypass, and now I would like to talk about SADI-S surgery and explain a little bit more about this procedure. And well, this is not a new surgery, but however, it is becoming increasingly accepted and performed worldwide. And it is a safe procedure, and it is also approved by the ASMBS, the American Society for Metabolic and Bariatric Surgery. So it is a safe and effective for weight loss process. It is a very good option. And I've been talking about many of the doubts and questions that my patients ask me when I'm in the uh, follow-up video call appointments or physical consultations, or even patients who are looking for a bariatric surgery, and they ask me many questions about all of this process. And as many of you know, there are different kinds of weight loss surgery. Gastric sleeve is the most bariatric surgery performed in the world, and there are other bariatric surgeries such as gastric bypass, are in raw and wide gastric bypass or regular bypass, and another is the mini bypass, and another is the SADI. And now we've been talking about SADI surgery. Mm, what is the main question is, what is SADI surgery? Okay, SADI means single anastomosis duodeno-ileal bypass with sleeve. SADI-S, the S is means sleeve. So single anastomosis, one anastomosis. Anastomosis is a connection between two structures, or in this case, organs, intestines, and stomach. And this is an anastomosis. So single anastomosis, duodenum ileal. Duodenum is the first part of the small intestine. Ileal is another part of the small intestine. So single anastomosis duodeno-ileal bypass with sleeve. That means that that procedure, the SADI-S, combines two main surgical techniques. One is the gastric sleeve, and or plus a bypass, not the regular bypass, is another bypass, is the connection or anastomosis of the duodenum with the ileum. So depending of the part of the intestine that you will bypass is the name that the procedure has in the studies. In this example is duodeno-ileal, single anastomosis duodeno-ileal plus sleeve. So SADI-S is a more aggressive surgery, or and more complex surgery than the sleeve, because it is SADI-S, we perform the sleeve plus the bypass. So this is what SADI-S mean. Single anastomosis duodeno-ileal, bypass plus sleeve. Okay, and this is not a surgery for all, as first option for all patients, but it's a very good option, and there are many patients who could be a very good candidate for the SADI surgery. We will be explaining about this, and another important question is what is the difference between the sleeve and the SADI-S? I think that I have already answered this question. Sleeve, only sleeve. We remove 80 from 70 to 80% of your stomach in the sleeve. SADI-S is the sleeve plus the bypass, right? So more complex. Now, difference between regular bypass or gastric bypass with SADI-S. Okay, in the regular bypass, we create two anastomosis. In the SADI-S, we only create or perform a single anastomosis, and the part of the intestine that we are bypassing is different. Um, and in the SADI-S, we the anastomosis, or the junction is of the duodenum with the ileum. In the regular gastric bypass or gastric bypass is different. So and they are different. They are the main difference between these procedures. Another important question is that patients ask me, how much weight can I expect to lose with the SADI-S? Okay, according to international trials, patients could lose from 70 to 100% of the excess of weight of total 170 from 100% of the excess of weight. And of course, you won't be alone throughout this process. It is very important that you be in communication with all the multidisciplinary team, not only the bariatric surgeon, and you will also have to be in contact with the bariatric nutritionist, psychologist, with the bariatric psychologist, and internist physician, and together will help you to have a better and successful weight loss process. So yes, you can keep off the weight for the rest of your life, while you have the commitment of the healthy habits, and not only eating, also about keeping an active life. And it is also important to explain that patients with SADI-S lose more weight than with the sleeve. They commonly lose more weight because of it is a more complex surgery, the SADI-S. And okay, this is about the weight loss. So that's why patients with morbid obesity, that means BMI higher than 40, it is a very good option, SADI-S, because that way they could, patients have more probabilities to get their goal weight. Okay. And now, other questions is in SADI-S. Is SADI-S is SADI-S a safe surgery? Okay, so yes, it is a safe surgery, and that's why it's approved by the ASMBS, American Society for Metabolic and Bariatric Surgery, and the risk of these procedures are like the other surgeries about bariatric surgeries, and but while you perform the surgery, not only during the procedure, not only in the in the operating room, uh, the bariatric surgeon and the multidisciplinary team must prepare you for your surgery as with any other kind of surgeries, any other kind of bariatric surgeries or general surgeries. I think that it is very important to prepare you for your bariatric surgery. In this case, we are explaining about the SADI-S. So okay, you must have your consultation with the bariatric surgeon. With a pre-op diet. Prepare your body for the surgery, and that way we can decrease even more the risk of complications during the procedure and after the procedure. Of course, in my team, all together follow all the recommendations of the international guidelines to decrease the risk of bleeding, risk of infection, and risk of leaks, like in the other bariatric surgeries. And they are short-term risk, but short-term complications, but there are another long-term complications. And I think that one of the main long-term complications in SADIs is malnutrition or nutrition deficiencies, and that's why it is very important, the guidance and support by the multidisciplinary team, not only bariatric surgeon, also nutritionist, that must guide you throughout the process to decrease the risk of malnutrition. Because yes, the risk of malnutrition is higher in SADIs than in sleep and gastric bypass. But while you follow all the recommendations, this risk could be very, very low. Of course, taking all the vitamins and supplements that we will recommend you, or that your team will recommend you. And for the rest of your life, yes. Other question is, should I take all the vitamins and supplements for the rest of my life? The answer is yes. Not only with the SADI surgery, also in any other kinds of bariatric surgeries, even in the sleep, in the gastric bypass, it is recommended to take them for the rest of your life. But um, maybe in the sleep you could stop taking them, and you could have malnutrition, yes, but the risk is not as high like in the studies if you don't take the vitamins and supplements. And in the studies, that's why it is mandatory to take them. And also, not only not only taking the vitamins and supplements, and also your team and you must take blood work frequently, every 3 or 6 months. It will depend of the patient, of course, as always. And that way we can confirm that everything is going well with your health condition. And that's why it is very important continue with the support and communication with the multidisciplinary team. Okay, and other questions that my patients ask me is that is a good option if I've already had another weight loss surgery before? The answer is yes. This is a very, very good option for patients that already had one or a prior bariatric surgery. and mm, they are candidate for a for another. They are looking for another bariatric surgery for some reason. Commonly, it's very common that they look for a second bariatric surgery or revision surgery because they regain the weight that they lost, or because they never lost the weight that they wanted, so they never got the goal weight that they were looking for. So yes, it is a very good option as a revisional surgery. But as I always explain, we must evaluate each patient. Each patient is different. It's not like, yes, it's the best option for everyone. Okay? And I'm reading in the comments, Abigail. Hello, how are you? Your question is SADI-S the same as bypass? Okay, no, it's not the same than well, people say bypass, and they refer to the regular gastric bypass or the Roux-en-Y gastric bypass. The complete name of the bypass or regular bypass is Roux-en-Y gastric bypass. They are not the same. They are different. Um, that was what I was explaining about the difference between the SADI-S and the regular or Roux-en-Y gastric bypass. The SADI-S is in the SADI-S we perform the sleeve and a bypass, but the bypass of the SADI-S is not the same than the bypass of the regular gastric bypass. In the SADI-S, the bypass is a single anastomosis. I explained that the anastomosis is a junction between two structures. In this case, duodenum. SADI-S is duodenum with the ileum, as we can see in the picture that is in the screen. So it's only one anastomosis in the SADI-S, and in the gastric bypass or regular bypass, we perform two anastomosis. So they are different. That means that performing two anastomosis increase the risk of complications, but you don't have to be scared because while your complete or multidisciplinary teams follows all the recommendations, the risk of complications are very low. So no, they are not the same. Gastric bypass and SADI-S, they are not the same. In the gastric bypass or regular bypass, we don't perform a sleeve. We create a very small stomach that we call it pouch in the regular gastric bypass or Roux-en-Y gastric bypass. And in the SADI-S, we create a sleeve. So they are different. And another comment says, I was told that with bypass, the patient will be on medication forever. Is this the same with SADI-S? Okay. Uh, okay, medication, do you mean with medication vitamins and supplements, right? Okay, ideally, yes, but not only with gastric bypass and not only with SADI-S. All the recommendation is with all kind of bariatric surgeries, even with gastric sleeve, even with mini bypass. But the difference is that maybe if you stop taking the vitamins and supplements with the sleeve 1 or 2 years after surgery, maybe you won't have the a severe malnutrition as you could have if you do it with SADI-S. Yeah, because SADI-S it is a more complex and a more complex surgery than the sleeve. But I always explain to my patients, I take vitamins, I take vitamins and supplements according to my requirements. And if you exercise, according to your weight, I don't have a weight loss surgery, but I want to take all the vitamins and supplements because I want to be healthy. So that's why I explain to my patients is just think about what do you prefer to take, vitamins and supplements to be healthier, or in the future patients that they don't have a bariatric surgery, but they have to take medication for other chronic diseases because of the weight. So I think that we must focus that vitamins and supplements are a complement or are good for a healthier life. So Yes, ideally for the rest of your life. Another question is, what type of bariatric surgery do you recommend? Okay, it will depend of each person. We must evaluate each person, and it is not like sleep for everybody, for everyone. No, studies for everyone. No. Uh, for example, someone who has severe acid reflux symptoms, not the gastric sleeve is not the best option. Either the gastric, either the SADI-S is not the best option. For patients with severe acid reflux symptoms, the best option is the gastric bypass or regular gastric bypass or Roux-en-Y gastric bypass. Is different names for the same procedure. So it's not the same. The best recommendation is going with your bariatric surgeon and evaluate all your medical history, and according to your medical history and your goals, you can take the best decision. But in general, gas severe acid reflux symptoms or moderate acid reflux symptoms, not sleep. The best gastric bypass. Patients with diabetes, type 2 diabetes, the best option is the gastric bypass. Sleep and SADI-S and will also help them. Yeah, sleep, SADI-S, and gastric bypass. But the best options is not the sleep, is gastric bypass, and even is the SADI-S too. And that way we can evaluate each patient. And okay, and according to the SADI-S, more doubts that my patients ask me uh, are that how will be my recovery, as it is a more complex surgery than the sleeve, so my recovery will be different. No, the recovery is commonly the same, and the same mean are the same days in the hospital, the same day at home resting, because SADI-S, as with the others bariatric surgeries, we perform by laparoscopy. They are laparoscopic surgeries. That means that they are minimal invasive surgeries. We perform very, very small incisions, the two incisions of 1 centimeter. They are the biggest one, and the other two size or measures a half of 1 centimeter. So they are very, very small incisions. The same day of the surgery, all patients are walking. The recommendation is walk every 2 or 3 hours for 10 or 15 minutes, and they can go home after two hospital nights. And patients who we have many patients from all over USA, Canada, and other countries, and they can go back home, 2 hospital nights and 1 or 2 hotel stay, and then they can go back home. But I'm in communication with all my patients throughout the process. All my patients have my cellular number, and when they have any questions, they know that they can send me a message, and I always I have a follow up with all my patients 1, 3, 6, and 12 months after surgery, and depending of the consultation of the findings. So, and I can give more consultations, and blood work are recommended 3, 6, and 12 months after surgery. And I think that it is very important that the follow up in all bariatric surgeries, but SADI-S, it is also very, very, very important. And do you have any questions, or would you like to know something else about the procedures, SADI-S procedure? And I think that I explained about the most common questions that my patients ask me, and about what is SADI-S, difference between SADI-S and sleeve and bypass, recovery. SADI-S as a revision surgery is a very, very, very good option as a revision surgery. Malnutrition after SADI-S surgery, and taking vitamins and supplements for the rest of their life. So if someone have any questions, I can guide you or help you, or you can send me a message. One question is, what results can I expect after the surgery? Okay, about weight loss, you can have benefits in weight loss, of course, and in controlling um, metabolic diseases or avoiding them. You can lose from 70 to 100 of your excess of weight. And okay, another question is, how fast will I lose my weight after a SADI-S? Majority of patients or lose that majority the first year after surgery they lose almost the most it is the most weight loss, but they can continue losing even the second year. But the first 12 months after surgery is when you will lose the more weight. And as we said, not only surgery, also the commitment with your healthy habits is very, very important. And about diabetes, hypertension, sleep apnea, high cholesterol, high triglycerides, they are chronic diseases that when you lose weight, many of my patients stop taking medication to control them. Other decrease the dosage or decrease the number of medications, but many of them stop taking the medications that they used to for controlling these metabolic diseases. And I think that this is very, very important to take the decision for having a better life and a healthier life, and it's okay. Okay. So if you have any other questions, you can send me a message, a DM, and I would be glad to answer all your questions and take the best decision. My recommendation is, if you are thinking about weight loss surgery or thinking about having a better life, is look for a multidisciplinary team, a specialist, and depending of all your medical histories, age, sex, chronic diseases, and initial weight, depending of many factors, your surgeon could take the best decision. So as we said before, it's not like this is the best surgery for everyone. No. We evaluate patients more than evaluate the surgeries. So my recommendation is you're looking for a healthier life and weight loss surgery, you can contact us or you can contact your surgeon, and together you can take the best decision for you.